Hello everyone, welcome to our presentation. We are group 1 and our presentation is on brain scan, making the invisible visible. And so our needs assessment group is made up of me, Johanna Schmitz, Jasmine Schulze, and Cassie Zimmerman. Now, individuals with brain injury experience a range of neurobehavioral symptoms that can profoundly impact daily function and quality of life. There is a growing body of research to support and guide effective treatment of brain injury, and identification of brain injury is the first step towards addressing it. But identification occurs most frequently in medical settings. Because identification precedes appropriate treatment, increasing identification rates is the highest priority need for individuals living with brain injury in Colorado. In 2018, MindSource received a grant to develop a state plan, a statewide structure to mobilize and communicate with organizations in order to better support individuals with brain injury in Colorado. One of the state plan's goals is to increase the screening capacity of Colorado community organizations. And to accomplish this goal, MindSource needs to start with an environmental scan to understand which organizations are currently screening, which are not, and which should be screening. To increase utility of the results of the environmental scan, a systematic process of data collection, as well as creation of a searchable database is necessary as well. And this is where our group came in. So the prioritized needs that we established as a group are for the individual to access effective brain injury screening for early diagnosis and supports. And this is mainly in community organizations in Colorado. Then the prioritized need for the organizations is to provide training and competency in conducting screenings. And then for MindSource, the prioritized need is to increase the screening capacity of Colorado community organizations.
Hi, this is Cassie taking over for a few slides. So it's estimated that between 40 and 42% of people with brain injury do not seek medical attention, a fact which Liz Girdman, our key informant and the director of MindSource, emphasized in our meetings with her. As Johanna has just described, this translates to a high prevalence of unidentified brain injury in Colorado. There are several underlying causes that influence this rate. For the individual, the general public has a limited awareness of the consequences of brain injury, so blows to the head are often minimized and normalized in our culture. At the secondary level, community organizations have been shown to effectively use screening tools to increase identification rates. However, across Colorado organizations, there is a lack of understanding of brain injury and available resources. Currently, knowledge about brain injury is not uniform and may come from a variety of sources, both credible and not. Many organizations are not screening at all, and those who are may be using screening tools with limited empirical support or tools that use ineffective language to elicit an accurate report. There's also limited knowledge of referral services and available supports in Colorado. Now, this heterogeneity is due to a current lack of unifying structure at the state level, and that is what MindSource aims to address in its state plan. As you might expect, the broad range of symptoms of brain injury can have a large impact on occupational performance. The occupational therapy practice framework provides a useful structure to understand its effects on the individual. Now, brain injury begins as a client factor. It is an alteration of brain and nervous system structure and function, which may impact physical, cognitive, and behavioral function as well. For physical function, changes in motor skills such as coordination and endurance may compromise performance of necessary daily activities, which can drastically alter habits, routines, and roles. In cognitive function, the most common symptoms are impairments in insight, memory, and executive function, and are often reflected in process and social skills. These can profoundly influence safety, self-care, education or work, and social participation. Behavioral changes may include increased impulsivity and verbal aggression. Such behaviors can damage relationships, impair social participation, and undermine valued roles. Over time, the combined effect of these symptoms can result in secondary and tertiary symptoms such as substance abuse and involvement with crisis services. And it's also important to note the critical role that the environment and social contexts play in helping or hindering occupational performance. For instance, homelessness is associated with an increased risk of brain injury. On the other hand, supportive family environments have been shown to increase long-term adaptive functioning scores in children with brain injuries. In approaching this project, we realized that Colorado is a large state with an abundance of community organizations. And we concluded that the best way to conduct a comprehensive scan would be to focus on one geographic area at a time. This brings me to our program goal, which is the completion of a pilot program to scan all community organizations in Larimer County. This will allow us to refine the process and develop a protocol for systematically contacting and communicating with organizations in the remainder of the state.
Here are our 3 underlying objectives for our program goal. Our first objective is to create a protocol that MindSource can use moving forward when contacting organizations in other counties. This will create a cohesive and efficient process, allowing for more organizations to be contacted and more individuals to be impacted. Our second objective is to create a comprehensive data sheet to allow for organization of the contact information and different responses of community organizations surveyed. This data sheet will allow all information to be organized and available in one place for everyone working on the project. Our third objective is to create momentum for the outreach program moving forward. Creating momentum is important for any project to keep it going strong. This will be accomplished for future researchers by providing a clear path forward and by community organizations continuing to express interest in receiving training. From the first half of the semester, we were able to complete an environmental scan. Through doing literature research and also communicating with our MindSource director, Liz Girdman, we were able to identify which organizations we needed to target about current screening procedures for clients with brain injury. Given the length of the semester, we decided it would be best to focus on one county alone, and that would be Larimer County, due to its location close to CSU and the current supports that are in place for individuals with brain injury. The second half of our semester, we decided to focus on creating the database for this pilot program. Here we used an Excel spreadsheet to record the names, contact information, and survey responses for each organization.
So now for the inputs. So the resources that we had for this project was Liz Girdman, who's the MindSource director, and Liz has a multitude of resources that she shared with us, and also so much knowledge about the subject of brain injury and why it's so important for community organizations to screen for brain injury. We also had MindSource resources such as their state plan and different research that they had as well. Then there is the needs assessment group members. So there's me, Johanna, and then also Jasmine and Cassie. And then as students of CSU, we have the Colorado State University Library, and that allowed us access to many research articles. We also created a SurveyMonkey account, which is how we developed the survey to distribute to the community organizations, and Microsoft Excel, which allowed us to create a searchable database. When searching through research and talking to Liz Girdman about which community organizations we should contact, we found that some of the most high-risk populations for brain injury are homeless individuals, individuals who have experienced domestic abuse, individuals experiencing mental health issues, and recipients of vocational rehab. Homeless individuals are at a significantly higher risk of sustaining brain injury than the general population. This number is as high as 5 times the rate of the general population. In a study by Audi et al., they found that homelessness and brain injury are highly correlated, showing that homelessness increases the risk of sustaining brain injury, but also that sustaining a brain injury puts individuals more at risk for losing their homes and jobs. Golden et al. Demonstrated that half of women who have experienced domestic abuse in their sample reported injuries resulting in loss of consciousness. The prevalence of brain injury in this population often goes unidentified due to fear of reporting the injuries and failure to seek medical care. Hux et al. Found that 58% of service recipients at a community mental health center yielded positive screens for brain injury, and another 25% had possible brain injury. It is estimated that up to 25% of service recipients at vocational rehab centers may have brain injury. All of these results strengthen the argument that community organizations should be screening for brain injury, as many individuals with brain injury do not seek medical care.
For this pilot program, we chose to focus our efforts on brain injury in the adult population around Larimer County. However, we received feedback and questions during our needs assessment presentation about the screening process for the Poudre School District. Our instructor, Dr. Pat Sample, connected us with Donna Dittmer-Hanna, an OT for the Poudre School District, to learn more about what the process might be for a student with a brain injury. Through email correspondence, she let us know that students are screened if there is a parent report of history of a possible brain injury, or if the team is questioning a possible brain injury due to the educational impact. However, a formal diagnosis commonly comes from the family doctor, the emergency room, or a neuropsychologist. The school psychologist may perform a screening within the school district. The school district uses the CSU brain injury screening tool, which Donna Dittmer-Hanna was present during the development of, if there are concerns for a possible brain injury. If the child needs academic supports, these can be provided through an IEP or an individualized educational plan. If a student needs accommodations in the classroom, this can be provided through a 504 plan. If a disability is suspected, the school team can move forward with an evaluation. The school has 60 days to complete an evaluation once parent consent to evaluate is received. If a student qualifies for an IEP, services will begin right away. At the start of the semester, we had a clear picture of what our outcome would be from our first correspondence with the MindSource director, Liz Girdman. We knew we would produce a searchable spreadsheet to track organizations who are screening for brain injury, those who are not screening for brain injury, and compile a list of organizations who should be screening, along with the contact information, what screening tools they are using, and their current level of interest in receiving training. The spreadsheet will enable MindSource to target training to specific organizations. Included in the protocol is also our email and phone scripts, the SurveyMonkey survey to send out to other organizations around Colorado, and class assignments to guide the next group who will take over collecting data for other counties in Colorado.